Good evening. My name is Tasha, and I'll be your student nurse on today. Do you mind by verifying your name and your date of birth for me?
My date of birth is March 5th, 1994. My name is Darius Langford.
Okay, thank you. Do you have any allergies, Mr. Langford?
No, excuse me, not that I know of.
Okay, and do you need to use the restroom?
No, ma'am.
Okay, so are you experiencing any pain at this time?
No, ma'am.
Okay, you're not experiencing any pain. Do you know where you are?
Yes, ma'am.
Okay, do you know today's date?
Today's date is May 3rd, 2020.
And if you don't mind me asking, where are you?
I'm at home.
Okay, do you know why you're here today?
Yes, for a head to toe assessment.
Okay, so what we're going to be doing, Mr. Langford, now I'm going to be asking you to close your eyes, and I want to assess your cranial nerves. Okay, we're going to start with cranial nerve 1. I'm going to place it in front of your nose, and you tell me what smell do you smell.
Vanilla.
Okay, so next we're going to be assessing cranial nerve 2. I want you to focus on my shoulder. Okay, next I want you to focus on this pen light. Okay, so my patient's pupils are equal round reactive to light and accommodation. So next I'm going to be assessing cranial nerve 3, 4, and 6. I want you to focus on this pen light again and just follow it with your eyes, okay? Okay, I also need to assess your head, looking for skin color, parasites, moisture, and just your skin integrity. Make sure no masses are in there. Okay, lift your head forward. I need to palpate your temporal arteries. Okay, so next I'm going to be assessing cranial nerve 8. So what I want you to do for me now, I want you to hold your hand on your left ear, occlude your left ear, and I'm going to whisper something in your right ear. I need you to repeat it for me.
My name is D.
Okay, cover your right ear.
My last name is Langford.
Okay, so next we're going to be assessing cranial nerve 5. So I'm going to place my hand here. I need you to open your mouth, clench your teeth. Next we're going to be assessing cranial nerve 7. So I want you to wrinkle your forehead, smile for me, puff out your cheeks. Okay, next I'm going to be assessing cranial nerve 9. I need you to swallow for me. Okay, next we're going to be assessing cranial nerve 10. I need you to say ah.
Ah.
Okay, the uvula is midline. Next, we're going to be assessing cranial nerve 12. I need you to stick out your tongue. Move it to the left. Move it to the right. Need you to say light, tight, dynamite.
Light, tight, dynamite.
Okay, next, we're going to be assessing cranial nerve number 11. I want you to shrug your shoulders for me. Okay, so I'm going to be assessing your carotid arteries. Okay. Now I'm going to listen to your arteries for a grit. Okay. Okay, so next I'm going to be palpating your lymph nodes. Pre-auricular, post-auricular, I think I'm saying it right. Submandible, submental. Okay. Superficial cervical, posterior cervical, occipital, or subclavicular. Okay, so next I'm going to be assessing your thyroid gland. Hold your neck up straight for me. Okay, I feel anything abnormal there. If I would have heard anything abnormal, I would have assessed it for a bruit. So next I'm going to be listening to your breath sounds. I'm going to listen to your bronchial breath sounds, which are going to be high pitched and loud. I'm going to listen to your broncho-vesicular, which is going to be moderate pitch and moderate amplitude. Then I'm going to listen to your vesicular breath sounds, which is going to be low pitch and soft amplitude. I want you to do a full breath for me each time I step. Gonna be your posterior. Deep breath for me. Okay, now I'm going to listen to your heart sounds with both the diaphragm and the bell. I'm going to start off with the diaphragm. Okay, I'm going to start off with your aortic, which is going to be your second intercostal space on the right. Now I'm going to listen to your pulmonic, which is going to be your second intercostal space on the left, and that is also what S2 is heard the best at. So next I'm going to Erb's point, which is going to be your third intercostal space on the left. Next, I'm going to tricuspid, which is in your fourth intercostal space on the left. Next, I'm going to mitral, which is in your fifth intercostal space, mid-clavicular. And that's also what S1 is heard the loudest at. Okay, next I'm going to auscultate your apical pulse for 1 full minute. Okay, let me check your skin circuit real quick. I forgot that one. Okay, so now I'm going to be switching over so I can listen with the bell, okay? Once again, aortic, pulmonic, Erb's point, tricuspid, mitral. Okay. So next I'll be assessing your skin, your upper extremities. I'm assessing for any edemas, temperature, skin moisture, skin integrity. Okay. So I'm gonna check your muscle strength. I want you to squeeze my hand. Bilateral muscle strength. Okay. So now I want to see your hand so that I can check for capillary refill. Okay, that's less than 3. Capillary refill is less than 3. I'm going to assess your brachial pulse and your radial pulse. Present. 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 Okay, present. So now I'm going to ask you to lay down for me. I'm going to assess your abdomen. I'm going to be inspecting your abdomen for the skin color. Okay, skin color looks good. Skin integrity looks good. Then I'm going to be auscultating your abdomen for bowel sounds, starting in your right lower quadrant. Bowel sounds present. Bowel sounds present. Bowel sounds present. Okay, bowel sounds present. So next I'm going to be palpating your abdomen for tenderness and bladder distension, okay? Okay, everything looks good there. I'm going to look at your lower extremities. Once again, I'm checking for the moisture, color, skin integrity, edema, tremors, all of that good stuff. Okay, so I'm going to check your bilateral muscle strength again. I'm going to place some resistance on the top, pull your foot back. Okay, do it the other way, push your foot out. Okay, so I'm going to be checking capillary refill on your toes. All are less than 3. I'm going to palpate the dorsalis not the dorsalis, the posterior tibial pulse. Okay, we're gonna be palpating your dorsalis pedis pulse. Okay, and your popliteal pulse. Okay, so I'm gonna ask my patient to sit up for me, and I'm gonna note that my patient in my patient's genital and buttock area, there are no lesions. My patient's hair is evenly distributed, and my patient's urethra is centered. The inguinal lymph nodes are located in the groin area. Also, my patient has femoral pulses of 2+, which is located just below. Which is located just below the inguinal ligament, halfway between the pubis and the anterior superior iliac spine. And I will also be leaving my patient with the bed in its lowest position, the side rails up, and the cowlite within reach. Thank you all.